The male external genital organs. The male external genital organs are presented by the penis and the scrotum. The male urethra also belongs to this group of organs. The penis serves to excrete the urine from the bladder and to bring the semen into the female. Genital passages. The penis consists of a glans, head, body and root. The body of the penis is a middle part, forwardly finished with the glands on the apex of the glands. The external urethral orifice of the urethra is situated. The glans has a wide part that is its cornea and a narrow part the neck of the glans. From behind the body of the penis finishes as its root. The superior anterior surface of the body is called the dorsum of the penis. There is a suture situated on the median line of the inferior surface of the penis skin, raphe penis. This suture transforms backwards into the suture of the scrotum and the perineum. In the region of the glans, the skin forms a fold that is prepuce or foreskin of the penis. The prepuce covers from the outside the caput and is attached to the neck of the penis. The inferior surface of the penis body is connected with the prepuce by the frenulum of the prepuce. The internal surface of the prepuce and the glans of the penis are covered by thin skin. There is a narrow cavity between the prepuce and the glans. The cavity opens with the orifice, from which the caput passes when the prepuce is pulled back. The penis consists of the right and left corpus cavernosum and corpus spongiosum. The corpus cavernosum are cylindrical and lies besides and above the corpus spongiosum. Corpus cavernosum are connected with each other along the median line and are covered by a common tunica albuginea. The tunica albuginea of the corpora cavernosa forms a septum of the penis. Between them, tapered posterior extremities of the corpus cavernosum diverge to different sides at the root of the penis, and in front the corpus spongiosum forms the caput, and in the back a bulb of the penis. CSP is covered from the outside by the tunica albuginea. The urethra is situated inside the corpus spongiosum. The fascia is more developed in the region of the dorsum than in the inferior surface. Two ligaments fix up the penis. 1. Superficial suspensory ligament from the white line, alba, and on the superficial abdominal fascia continues with the superficial fascia of the penis. Fundiform ligament originates from the surface of the pubic symphysis and it is inserted into the tunica albuginea of the corpus cavernosum. During erection the caverns are filled with blood, their walls straighten. The corpora cavernosum and spongiosum swell and significantly grow in size and become firm. 1. The scrotum. The scrotum is cutaneomuscular pouch which is derived from the anterior abdominal wall. The scrotum contains the testes, male genitals glands. It goes down and back from the root of the penis. In the perineum region, the scrotum consists of 7 layers. 1. From the outside it is covered with skin. The skin of the scrotum is thin, pigmented, easily forms folds, and is covered with hair. Then the dartos fascia formed by subcutaneous CT and contains bundles of elastic fibers, smooth myocytes. Forms the septum of the scrotum which separates the testes. External spermatic fascia derived from superficial abdominal fascia. Cremaster muscle formed by the branching fibers of internal oblique and transversal abdominal muscle. 5. Cremasteric fascia derived from the proper fascia of the external oblique muscle. 6. Internal spermatic fascia derivation of the transversalis abdominal fascia. Serous vaginal layer of the testis. Parietal and visceral layers. On posterior side the parietal layer transforms to the visceral layer which covers the testis and its epididymis. Between the parietal and visceral layers a narrow closed serous cavity is situated. 2. Spermatic cord. It is a round cord, extends between superior extremity of testes and the deep inguinal ring. The spermatic cord consists of vas deferens, the testicular artery, the artery of the vas deferens, convoluted pampiniform plexus, lymphatic vessels of the testis and epididymis, nerves and vestige of process vaginalis. The spermatic cord is surrounded by a layer which continues onto layers of the scrotum. The external layer of the spermatic cord is the external spermatic fascia. Under this is the cremaster muscle, cremasteric fascia, and the internal spermatic fascia. 3. The male urethra Li is a non-paired tube which excretes urine and sperm. Urethra is divided into 3 portions. Prostatic greater than passes vertically through the prostate. There is a longitudinal eminence on the wall of the prostatic urethra called the crista of the urethra. Its most elevated part is the seminal colliculus. There is a depression on the apex of the seminal colliculus, a prostatic utricle. On each side of the prostatic utricle the left and the right ejaculatory ducts open. Numerous orifices of the prostatic ducts go into the prostatic urethra. Membranous. This is the intermediate part of the urethra. Extends between apex of the prostate and the bulb of the corpus spongiosum. It is the shortest portion greater than it goes through the urogenital diaphragm. The spongy urethra greater than it is a part of the corpus spongiosum greater than in the region of the glands. The urethra widens forming the navicular fossa. The urethra has two flexures. A. Superior, it is convex and goes straight up and is formed by prostatic and membranous urethra. B. Anterior, goes down and back. Situated in the region of attachment to the penis of the fundiform ligament, which is the border between the fixed, superior, and agile, anterior, portions of the urethra. The mucosa of the urethra has a lot of small pit-like recesses or urethral lacunae and is covered with epithelium.